with the digestive system, and you know that the upper part of the digestive system has got some functions with the respiratory system as well. So let's see this one first. All right, so actually you can go over there. You don't need to be like behind me because I'm going to show you things like this. Okay, all right, small class is always good, right? Yes. So this is our upper, you can say, GIT or upper respiratory tract. Here we have got the mouth. This is the oral cavity. Same thing you can also see over here. This is the mouth, oral cavity. This part is the hard palate. The posterior part is the soft palate. As you can see, things exactly like this. Then we have got something called oropharynx right here. Then we have got one epiglottis, as you can see right here. You don't see it right there that much, but anyway, that will flip down and then it will cover the respiratory passages so that food can go right through the esophagus. I'm not going to ask you about the respiratory system anymore, you understand why. So this is the esophagus. Behind the larynx, it will continue as esophagus. So this is the esophagus, one muscular tube, and this esophagus will end up in the stomach. So this is the stomach. Stomach has got several parts and some features. The feature is right here. You can see some wavy things. These are called rugae, right? Rugae. So if you see one sticker right here asking you what this thing is, so try to say rugae. And other things are like parts. So this part is called cardia, or cardiac end of the stomach. Then we have got the fundus, the dome-like area right here. And then we have got the body, middle part. And the last part where it meets the duodenum, this part we call it pylorus. And can you see something a little bit like light purple in color? That is called the pyloric sphincter. All right, can you see the thing? Pyloric sphincter. Cardia is the upper part of the esophagus, upper part of the stomach where esophagus meets. We have got two curvatures, the bigger one, greater curvature. You got a question like this actually, and then this one is the lesser curvature, right? Lesser curvature, greater curvature. So more or less these are the features of the stomach. Put this thing aside, now let's see the other thing. After the stomach, this part is the beginning part of the small intestine, you call it duodenum. It has got some parts, but I'm not going to ask you about the parts. I will ask you about these ducts. So you see this structure is called pancreas, right? Pancreas, and we have got two ducts coming from pancreas, these two white lines. The main one is a little bit below the smaller one. So this is the main pancreatic duct, and this is called the accessory pancreatic duct. All right, main and accessory. And this green one is coming all the way down from the gallbladder, and you call it the cystic duct. All right, so common bile duct. Common bile duct. All right, common bile duct. So this is the common bile duct. So this is the duodenum. The next part of the small intestine is in the right upper part of our abdomen, right here. This is called the jejunum. So if you see a sticker over here, I'm asking about jejunum. If you see the sticker right here, most probably I'm asking about the ileum. All right, and you see the ileum enters into this part called cecum, and there is a valve over here called ileocecal valve. Something hanging from the cecum, this is called appendix, and this is the cecum one more time, ascending colon, transverse colon, descending colon. It's not that much curve, but you know that this part is the sigmoid colon. The straight part is the rectum, last part is the anal canal. All right, and do you know these bands? What are they? These bands? No, tinea coli. Tinea coli. And those swollen areas, these are called haustra. All right, so tinea coli and haustra. Right, look at the picture, that will help you. All right, diagram, that will help you. So this is more or less about the model. All right, and we have got another last model actually, this one. This one is the microscopic anatomy of small intestine, and you can think that it's like 1 million times enlarged, so that's why it is big, right? These finger-like projections, we call them villi, right? Villi. And on top of the villi, these cells, these are the simple columnar epithelium. In that microscope, you actually see this part, right? So this is a simple columnar epithelium. You can see the capillary network right here, right? Capillaries, regular capillaries. What about this? This white one, what is this called? What is this? This is the lymphatic channel. We call it lacteal. Normally, it is in green. Normal books or other diagrams, they actually try to show it in green, but for some reason, they ran out of green color, so this is white. All right. So, but this is the lacteal. You can see the difference. Capillaries are very narrow, but the lacteal is really, really wide because it needs to absorb the fat, right? So, if you just try to analyze, that will help you. So, this is the lacteal. So, simple columnar, regular capillaries, lacteals, these are called villi, right? Small intestinal features, all right? So, if you want, you can take some photos, right? Any question? Know this, you know this. So, this is the kidney, and kidney has got some, you can say, areas. The outer area, you call it cortex, as you can see right here, and the inner area, you call it medulla, right? Medulla. These are the pyramids, right? You can see pyramids, and the tip of the pyramid is called papilla, right here, right there, right there. These are called papilla. Each of those papilla, they open in some small funnel-like areas, right here. You can see minor calyx, right? Minor calyces. 2 or 3 of them, they join to form a bigger one. You call them major calyx. One over here, another one over there. You can see right here, right there. These are all major calyces. The major calyces, they join to form a big funnel. This is called the renal pelvis. And the pelvis will continue as ureter. What else you know? The spaces in between the minor calyx, where you can see the blood vessels and things like this, these are called renal sinuses. And in between the pyramids, these areas, right here, right there, you call them renal columns. Alright, renal columns. What else you see? You see some blood vessels over there. You see this is the renal artery. It will at first become interlobar artery, then they will become interlobular artery. Then this is called the arcuate artery, right? You can see the arcuate artery right here, arcuate artery. And these radiating ones, you call them radial arteries. All right? Just know that much, nothing more than that. These small button-like areas, these are called renal corpuscle because they have got the glomerulus, the cup-like thing, and glomerular capsule, the cup-like thing, and glomerulus, knot of capillaries inside them, right? Inside them. So I'm not going to ask you that many questions from here. I'll ask you some questions from here. This is actually the enlarged version of this part. So right here you see this is the Bowman's capsule or glomerular capsule, right? And this is the glomerulus. On the glomerulus, you can see some cells over there. These yellow things are actually cells, and you call them podocytes, right? You remember? Podocytes. They control the filtration. There are 2 blood vessels attached. One is called afferent arterial, another one is efferent arterial. How do we know which one is afferent, which one is efferent? Because they look like the same, red, right? So afferent arterial is normally bigger and thicker than the efferent arterial, right? So this is the efferent arterial. This is the efferent one. What about these 2 tubes? The one just coming out from the glomerular capsule, you call it proximal convoluted tubule. Actually, this is the part right here, proximal convoluted tubule. And this one is the distal convoluted tubule. How do you know? Because the distal convoluted tubule will come back to the glomerulus, but will not be connected, but will come back to the same glomerulus to form something, called juxtamedullary apparatus, right? To control the blood vessel. So pretty much this is it. So let's try to review very quickly. Alright, one thing I actually missed, I'll tell you that thing as well. So this is our kidneys, this is the cortex, this part is basically medulla, but specifically speaking, these are renal pyramids, renal papilla, renal column, renal sinuses right here, and minor calyx, major calyx, this funnel-like area, pelvis, the thing is called ureter. This part is called renal hilum, right? You remember? Renal hilum. So what we have got the ureter, we have got the renal artery, we have got the renal vein, we have got some nerves coming in or going out of the kidneys, right? So this is the port, renal hilum, all right? So we also have got some blood vessels afterwards. This is interlobar, interlobular, this is arcuate right here, and then we have got radial, like this type of long things radiating like sun, radial arteries, okay? And this is the Bowman's capsule or glomerular capsule. Inside we have got the glomerulus, afferent, thicker, efferent. The one connected to the Bowman's capsule is called the proximal convoluted tubule, and this one is the distal convoluted tubule, right? And now let's see that thing right here, okay? Okay, I forgot to mention about this, right? Okay, I'll tell you about this. So this is the model showing you almost everything of the urinary system. Two kidneys, you can see they are connected with the abdominal aorta and inferior vena cava by some vessels. You call them renal arteries and renal veins respectively. And on top of the kidneys, you know, these glands are adrenal glands, right? And right there at the bottom we have got ureter connecting the bladder, right? So this is the bladder. Urinary bladder, if you open up the bladder, you can see one triangular area. Two ureters will open right here. Actually, this is better seen from this side, but this side very difficult to show. So this is actually the trigon, and this is definitely a male urinary system, because you can see the seminal vesicle, you see the ductus deferens, and most importantly, you see the prostate, right? And then we have got the urethra downstream. All right, so that is something from the urinary system. Very easy. Don't panic, just see what things are over there. I forgot to mention about this, but this thing is pretty easy. This is the liver. What is the name of this blood vessel? Going right through the liver? Inferior. Superior one is actually above the diaphragm. So we're talking about below the diaphragm, inferior vena cava. What is this? Gallbladder. And the duct coming out from the gallbladder is called cystic duct, because this is called a cystic duct. All right. So this is all liver. All right. So liver, we are done with the digestive system and the urinary system, and you can take some photos. Then we'll move for the reproductive system. Bladder, and goes posterior. How do I know this is posterior? Because once again the rectum is over there, right? So this ductus deferens, it will meet the seminal vesicle. So one is right here, another one right there. Two seminal vesicles, one on each side. And before it meets, there is a Solon area. Any Solon area, most of the times we call it ampulla. So this is also ampulla. You have seen uterine ampulla, now see the ductus deferens ampulla, right? Uterine tube, because you saw the ampulla. So this ductus deferens will meet the seminal vesicle, and now it will go right through this gland, and as you can see, this gland is called prostate, right? Prostate gland. And this short length, after meeting the seminal vesicle, and this short length just before or meeting the urethra, this is the urethra, this short length is called ejaculatory duct. Within this prostate, this is called the ejaculatory duct. And rest of the story we actually know. So this is the urethra. Total length of urethra is near about like 8 to 10 inches, and this time urethra has got some divisions. The first part of the urethra, which is going right through the prostate, easy, you call it prostatic urethra. And then there is a sphincter. We have got a sphincter right here that is involuntary, but this sphincter is voluntary, maintaining our dignity, you know. So this is the external sphincter, and right through this the urethra will go. And here, actually not shown here, but urethra is very narrow, and that's that part of the urethra. This small part of the urethra is called membranous urethra. All right, membranous. So if you see the sticker pointing at this part and asking you the name of this part of the urethra, this is membranous urethra. The remaining part will go through the penis, and you know that this the structure of the penis is called the spongy corpus spongiosum. So you can call it penile urethra from here to there, or you can call it a spongy part of the urethra. So this is the corpus spongiosum. Corpus spongiosum has got two features. At the end we have got glans penis, and at the beginning we have got bulb of the penis. It looks like a bulb, a light bulb, alright, so that's why it's like bulb of the penis. And this ash colored area, this is the different thing. Actually we have got two of those things. We call them corpora cavernosum or corpora cavernosus, alright, similar. Okay. Now let's see the inside of the testis. You can see both the things similar. So here we have got seminiferous tubules, no worries about that. Here you actually have got epididymis. You can see the epididymis. In between the seminiferous tubules and epididymis, this is the posterior part of the testis. Same here, posterior part, and you call it rete testis. You remember the word R-E-T-E. Rete means actually back. So this is the back of the testis, just before the beginning of epididymis. All right. So also you can see the ductus deferens right here. Can you see the ductus deferens is going like this? Ductus deferens, same story, it will hook over the urinary bladder, going back, and rest of the story, you know. What is this again? Ureter. One more time, this is the ureter. Alright, this is the ureter. And we have got something like blood in between bladder and the rectum, that's called vesicouterine pouch. Not that much clinically important at this point. Alright, somewhat clinically important, but not that much. Now let's see the urethra one more time. Three parts. This is the prostate, so prostatic urethra, where we have got ejaculatory duct meeting with the posterior part of the urethra. This is the external sphincter, so we have got the urethra going right through it, called membranous urethra. Rest part we call it sponge urethra, or you can call it penile urethra. This is the bulb of the penis, and this is the glans penis. Both of the things are the components of sponge corpora spongiosum, and this is the corpora cavernosum. A little bit tougher than this one. All right, a little bit tougher than this one. All right, anything else? Not so much. Just here you can see that I wrote testicular arteries, veins, this type of things. So these are the testicular arteries or testicular veins right here, or you can call them gonadal arteries or gonadal veins. Since this is from male, so that's why I said testicular, but it is the same for the female. So they have got very long like arteries, very long veins connecting the ovaries or the testes. And the blood vessels supplying the gut, this is the celiac trunk, the topmost one. This is the superior mesenteric artery, this is the inferior mesenteric artery. I'll not ask you about the common iliac or the arteries or veins, because we are done with this kind of things already. Alright, so now see both the things, okay? Anything you have fornices, right? Fornices all around the cervix. So this is the cervix, external os, internal os, cervical canal. This is the uterine cavity. This is the ovary. You have seen under the microscope. This is the ovary, and ovary has got, you see, that series of ovulation things happening over there, right? So these are called Graafian follicles. This type of things are called Graafian follicles, and right now we have ovulated, right? After the ovulation, you know that the remaining Graafian follicles, they will become something called corpus luteum. This is yellow, right? Luteum means yellow, so you can see this is yellow, so nothing to miss. And if there is no pregnancy, this corpus luteum will become fibrotic, will become like a scar tissue, so it will be called corpus albicans. Alba means white, so you can see it white, right? Corpus albicans. So after the ovulation, you see that these are the fimbria, will grasp the ovum and will pass the ovum right to this part called infundibulum, and this is the ampulla. Can you see those small blue things? Looks like something we know, right? Sperm. So sperm and ovum will actually meet here in the outer 1/3 of the uterine tube, and then the rest of the story you know. So they will form the zygote, and zygote will divide and divide. So this is the time to fertilize the egg. Fertilize the egg is called zygote. So soon after the zygote is formed, we start dividing, called cleavage. So you can see 4 cells, 4 to 8, and then we have got a cluster of cell like this, and this is the morula, just like mulberry, right? You can see something like beaded. So this is the morula, and after morula we have got blastula, and then we have got 3 layers of germ tissues over there. All right, so this is the yellow one. Close to the yellow we have got endoderm. Close to that should be actually blue. Most of they ran out of blue color, so that should be blue. So here we have got ectoderm, and in middle we have got mesoderm, right? Right here we are like moving further. So right here endoderm, we have got the yolk sac, and the ectoderm right here we have got the amniotic sac, right? So that amniotic sac will eventually cover the whole fetus anyway, but you can see the fetus right here. This is the head part, this is the tail part. I'm not going to ask you every detail, but I'll ask you maybe which one is the yolk sac, which one is the amniotic cavity. This type of questions will be asked, okay? So just take it easy, see the thing, and you have seen this type of diagrams already in your slides, so most probably you will not face any problem, all right?
Are you asking about the distal?
No, I'm not going to ask you about it. Put a pin here asking you what is the structure right here underneath the liver and the gallbladder. Alright, gallbladder. So very soft, just like a sac, alright? So this is the gallbladder. Okay. Now here we have got the stomach. This is a bag, right? Bag. And the stomach has got a neighbor. You actually can see that neighbor over there too. That is the spleen. Alright, you can see the spleen. And what is that? Nice. Greater omentum, right? Greater omentum. And if you flip the greater omentum, you see greater omentum is attached to the stomach, right? No way to miss it. Then we have got the small intestine, right? Small intestine. Large intestine should be actually by the side. Not on top, not underneath, by the side. So this is the large intestine, right? And do you know about this membrane? What do you call it? Mesentery, right? You are mesentery, all right? Mesentery. Now, do you know this structure? Kidney. And what is the other one? Here is the other one, right? Okay. And this cat, we can see actually another tube right here. What do you think about this tube? Right, you are ureter, all right. So not always we see, but for this kidney we see that. What is this? Bladder. Sure. Bladder. Now what is this?
Columnar Arteries.
Urinary bladder is here. So what could be this? I understand this is difficult. This is the uterus, right?
Yeah.
Cat uterus is kind of like why? Because they need big space. How many kittens we have like at a time? 6, 7, 8, right? So to accommodate all those kittens, they need actually a very big uterus. So the uterus, the ovary is right here. You can feel the ovary right here, and the uterus is right here. Uterine tube becomes uterus actually. That is the thing. So this is a female cat. All right, female cat. All right. Now I'm gonna show you the kidney. All right. Do you have any question? You can ask me. All right. Okay. What is the kidney? Somebody took the kidney. I actually left a kidney right. Oh yeah, here. I thought they made some stew or anything like that. Okay, so this is the kidney. All right, sheep's kidney, of course. So outside we have got a layer of connective tissue. This is called renal capsule. All right, renal capsule. You can easily see the renal capsule. If you open the kidney, you can clearly see two zones. Outer zone you call it cortex, and inner zone you call it medulla. Even though there are some triangular things, but these are not so much clear, so I'll ask you about the pyramids with the model you have seen already. These are the parts where we have got minor calyces, we have got major calyces, and eventually will become the pelvis. But this part is a little bit difficult for us to find out the calyces because these are full of debris. This is like dead thing we are talking about, so we don't really see the open spaces here. So to make our life a little bit comfortable, they call it pelvic calyceal system. Pelvis and calyces, all the calyces together. So this part is the pelvic calyceal system, which will lead us to this thing called ureter. All right, and this is the renal hilum. So not many things. You see only a few things: cortex, medulla, pelvic calyceal system, ureter, and this is the hilum plus the last thing, renal capsule. All right. Is anything confusing? No. All right.